I'm Dr. Donica Baker, a rheumatologist with medical specialists at St. Luke's Hospital. I grew up here in Chesterfield. For college, I went to the University of Michigan in Ann Arbor, and I came back to Missouri for medical school and my fellowship as well. And I finished fellowship this year in 2019, and I'm very excited to be here at St. Luke's Hospital. I specialize in rheumatology, which has to do with arthritis and autoimmune diseases. I see a lot of patients with rheumatoid arthritis, lupus, conditions that affect the immune system and cause a lot of pain, fatigue, and other symptoms. I was always interested in the musculoskeletal system, and I really wanted to help patients improve their quality of life and be as functional as they possibly could be. I thought it was a specialty that really helped improve patients' mobility and help them become be as active as they could be, enjoy the hobbies that they used to enjoy. I would hope my patients would think I'm caring and feel that I'm probably a little bit more laid back than other physicians. I like to get to know the patient personally and see what their hobbies are, what they like to do outside of what I see in the doctor's office. I like to learn about their families and what makes them themselves. I really enjoy music. I grew up playing piano, was part of a choir, and I think music has always just been so healing for the soul. I enjoy helping patients become more functional, to reduce their pain, to help them improve their quality of life and be able to perform their activities of daily living. I like it when I'm able to meet a patient who starts off with a lot of pain, but I'm able to help the patient reduce their pain and become more functional again. And that is very satisfying to me. Medicine sends so many ripples through the community. By helping one person, that person's able to help the people around them, and that's very meaningful to me. I've always loved the sciences. I've loved learning about the human body and about anatomy. In college, I majored in kinesiology, which has a lot to do with human anatomy and physiology, and that played into my interest in musculoskeletal system as well. My parents were also physicians in China, and when we immigrated here, they did kind of influence me to become a physician, and I learned a lot of pearls from them. And I'd say just from a young age, I've always been interested in medicine. In rheumatology, we see a lot of patients with rheumatoid arthritis. I'd say that's my biggest population of patients. I also see patients with psoriatic arthritis, which happens in patients with psoriasis and arthritis as well. I'd say lupus is another huge category of patients that we see. Ankylosing spondylitis. We also see patients with more rare diseases such as vasculitis and auto-inflammatory conditions. We also see patients with some strange symptoms that a lot of different specialists are trying to figure out, like fever of unknown origin, or maybe a rash that nobody knows what's going on. And we work really closely with almost every other specialty to figure out what these symptoms may be due to. A lot of people have osteoarthritis, which is wear and tear arthritis that we almost all get as we get older. That's really different from rheumatoid arthritis, which is an autoimmune condition, a derangement in your immune system that causes your immune system to attack your joints and tissues rather than bacteria or viruses in the environment. And it's a very different distinction to make because the treatment is incredibly different. In osteoarthritis, we treat it more so with conservative therapies like Tylenol, ibuprofen, physical therapy. Patients may need a joint replacement surgery eventually. Whereas in rheumatoid arthritis, we treat it with medications that tone down the immune system. For example, a lot of patients have probably heard of Humira, which they have a lot of commercials about on TV, and that's a medication to kind of dampen down the immune system so that it's no longer causing inflammation in the body. The symptoms of rheumatoid arthritis include joint pain and swelling, usually in the small joints of the hands, like the fingers or the knuckles and wrists. That's opposed to osteoarthritis, which causes more joint pain in large joints, like the hips and knees, which are weight-bearing joints in the body. And the cause of rheumatoid arthritis is actually unknown, but it's speculated that maybe it's caused by a past infection or some kind of genetic predisposition. If you've been diagnosed with a condition like rheumatoid arthritis, the bad news is you have an autoimmune problem, but the good news is the treatment nowadays is incredibly good. So the next steps would be to check some baseline labs to make sure your body's okay to start any new medications, and ruling out any infectious diseases to make sure your body can take medications that can tone down the immune system. The next step would be choosing a medication that would be right for you. After the baseline labs are checked and normal, we would discuss which one of those would be the right one for you. There is something called an anti-inflammatory diet that patients can eat, and it's changes in your diet that you can take to reduce inflammation levels in your body. It's things like eating more fruits and vegetables, eating less red meats, and if you are going to eat meats, grass-fed tends to be better than not grass-fed. It's also adding spices into your food like ginger, turmeric, or cumin, which are known to reduce inflammation levels in the body. Now, these changes in your diet will help to reduce inflammation, but they're not going to completely make all the changes that are necessary for your disease process to get better. So you will still need medications usually, but eating healthy in general helps you to feel better, reducing sugar, and staying as active as you can.